Why do you need a biopsy for a celiac disease diagnosis? Welcome to Decoding Celiac. I'm Dr. Shelly Gunn, founder of Targeted Genomics, where we use genetic testing to help people understand their risk for celiac disease and gluten sensitivity. In my previous videos, we talked about the first two pieces of the celiac testing puzzle, genetics and antibodies. This video is about the final pieces of the puzzle, symptoms, family history, and biopsy. How does biopsy help diagnose celiac disease? Biopsy allows us to actually see the damage celiac disease causes to the tiny finger-like projections lining the small intestine called villi. Healthy villi stand upright and help absorb nutrients, but in celiac disease they are flattened and damaged, a change you can see through the microscope looking at biopsy tissue. For this reason, biopsy has long been considered the gold standard for confirming the diagnosis, but it is an invasive procedure requiring anesthesia. Genetics and antibody testing are newer non-invasive options. However, none of these three tools, genetics, antibodies, or biopsy, can diagnose celiac disease on their own. Genetics tells you if you're at risk, but doesn't detect active disease. Antibodies detect active disease, but only if you carry the celiac risk genes and are eating gluten. Biopsy confirms intestinal damage, but it is not totally specific for celiac disease. That's why this is truly a diagnostic puzzle. Symptoms and family history can help solve the puzzle. There are over 200 symptoms linked to celiac disease. The most common include diarrhea, weight loss, and vitamin deficiencies. But many people also experience non-GI symptoms such as skin rash, joint pain, and depression. Celiac disease also runs in families. Having a first-degree relative, parent, sibling, or child with celiac increases the likelihood that you will develop it. You can use genetic testing to find out who in your family is actually at risk. How do you put all the pieces together? Start with GlutenID's genetic testing for celiac disease. If you don't carry the risk genes, you don't need any further celiac testing. You can begin looking for other causes of your symptoms. If you do carry the risk genes and have symptoms, your next step is antibody testing, followed by a biopsy if needed. Remember, the purpose of a biopsy is to confirm intestinal damage. In my next video, we'll see how biopsy can help make the diagnosis when genetics and symptoms strongly suggest celiac disease, but antibody testing is mysteriously negative. If you found this video helpful, subscribe and visit our website to learn more about at-home celiac testing. See you next time.